We are going beyond the headlines, asking the questions you want answered, exploring government policies and how they impact you. We are delving deeper.
Good evening and welcome to Delving Deeper. I'm your host, Sunil Lalla. Joining us this evening is the Honorable Terrence Deyalsingh, someone who has led the Trinidad and Tobago throughout the COVID-19 pandemic. We've seen him quite a lot. He is the Minister of Health. Minister, welcome back.
Thank you very much for having me, Sunil. And I remember you questioning me rigorously during COVID.
Minister, I know we're in the midst of the election season. I want to thank you for giving us some time. But first, before we go into, I have a list of questions for you.
Okay.
I do want to find out first, though, Minister. We saw you on the PNM platform a couple of weeks ago. I want to know if that jump that you made has so much memes. Was that premeditated?
It wasn't premeditated. It sort of came spontaneously while I was sitting to go on. I said, I have to do something different. So I came up with that maybe about 2 minutes before. So it was slightly premeditated, but I am so glad that people are making fun of it. I embrace it, and I have no problems with the memes, absolutely none.
We're glad to hear that, Minister. So my first question to you, you're seeking re-election in the Arangwes St. Joseph constituency. Tell us about how the campaigning, how that has been going so far.
The campaigning is going pretty well. I mean, I've been the MP now since November 2013. So I've been there for 12 years now. A lot of development has taken place, especially in the underdeveloped areas of the constituency, like Mountdor, Quarry Drive, Quarry Road, some parts of Chamflair, some parts of Mount Lambert, My Tower, Spring Valley. So I've really focused on the underdeveloped parts to make sure that their level of development comes up to the other parts of the constituency. So I'm very proud of that.
The constituency has changed somewhat from St. Joseph. It's now Arangwes St. Joseph. And are you concerned about the boundary changes, or do you think you'll be successful again in retaining that seat?
So whilst the EBC changed the name of the constituency, the boundaries remain the same. So they have just recognized Arangwes as a big chunk of the constituency, but there have been no boundary changes. So we fight in the same number of polling divisions.
And how confident are you going into the election?
I am pretty confident, but not complacent. I am confident that I have done the work. I am confident in the work I am doing, and I am confident in the work I have to do between now and April the 28th. Once I continue working and continue representing the values of St. Joseph as a married man with children, those values are almost identical to those of the people of St. Joseph. I think we will do well.
What are some of the issues we see in your constituency, and what have you been able to help the constituents, and what do you intend to in the next 5 years if you're selected?
So as I said, the underserved part of the constituencies, especially those parts north of the Eastern Main Road, have been neglected by all MPs in the past. I changed around that. So better roads, better water supply, community centers with ICT technologies, so that the young children in those centers, like in Cayman, in My Tower, in Quarry Drive, they could be the Bill Gates of tomorrow. We have to bridge that digital divide between the haves and the have-nots. And I think my focus on the youth, on the young people going forward, even the not so young, to show them all the programs that this government has for them under the Ministry of Youth Development and National Service. My mantra going forward is the youth, both in ICT and in entrepreneurial pursuits.
Talking about the Ministry of Health, we recently saw the Port of Spain Central Block being opened. I understand from some of the speeches that we would not have patients until July in the facility. Could you explain to the viewers why?
So if you look back at all the hospitals we opened, Point Fortin, Sangre Grande, Arima, we never took in patients the day after or even the month after. When we open a hospital in the past, staff have to get accustomed to the flow of the place. So in the case of Central Block now, which is a massive 540-bed tertiary hospital, what we celebrated on Monday the 10th was the practical completion of construction. So the construction is completed, and I took the media in to see a model ward. So we still have some work to do on other floors, and first patient intake by July, following a similar pattern as we did with Point Fortin, Arima, and Sangre Grande, and more recently, the A&R Robertson Airport in Tobago. We celebrated the practical completion of construction.
Minister, how critical was it to have this facility actually in place at this point in time?
Okay, so this facility should have been finished over a year ago. We had two major issues. One, COVID. This was being built during COVID. Two, last year there was drought in the Panama Canal. Ships were delayed up to 3 months. And three, there was a contractual dispute with the original contractor. So it is not timed for election. Because of those three issues, this project should have been finished about a year and a half ago.
As you spoke about, COVID, that was in the last 5 years. That was one of the major areas that your ministry would have had to collaborate. We saw your face almost every day from April 2020. And ahead of the elections as well, after August, we had those spikes in COVID and so on. But do you believe that was one of your areas where the Ministry of Health excelled in collaboration with the other ministries and the Office of the Prime Minister as well?
But it wasn't a matter of excelling in comparison to other ministries. COVID was novel. It was new. The world didn't know what to do about it. But I am proud of all 22,000 healthcare workers who went beyond the call of duty to make Trinidad and Tobago one of the safer places for COVID. I'll tell you something, we took hard action. And when I meet people on the streets, they said, Terrence, some people call me Terrence, Uncle Terry, Minister, whatever. They said, we may never vote for you. We may never vote for your party, but we are glad that the PNM was in office during COVID because you were the only party with the only prime minister to take hard decisions. Other people may have taken popular decisions and the easy way out. But people will tell me, we appreciate the hard decisions that your Prime Minister, Dr. Rowley, and you had to make to save my life. I get that every single day. And that was what really separated our COVID response from those who took us to court over 60-something times, fighting everything from the closing of bars to the closing of the airports and so on. That is what we had to fight. We not only had to fight COVID, we had to fight the opposition so that we could save lives.
Minister, the Ministry of Health would have received in excess of, I think, $20 billion over the last 5 years. Can you tell us about how this benefited the people of Trinidad and Tobago and, how effective was it?
The Ministry of Health receives an annual allocation of roughly 6 to 6.5 billion, give or take. It may shock you, Sunil, and your listeners to understand, to find out, to learn, to hear that over 60 to 70% of that goes towards salaries and wages. Between the Ministry of Health and the RHAs, we employ 22,000 persons. Multiply that by mouths to feed. We are probably responsible for almost 10% of the population being able to pay rent, buy food, and so on. So 60 to 70% of that $6 billion goes towards salaries and wages. Another significant part goes towards recurrent expenditure, electricity, lights, water, and then the balance is to healthcare. So that is what we do. And with that balance, how has the population benefited? They have benefited from not only new hospitals, but the type of excellent care they get. and from Point Fortin to Arima to Sangre Grande to Mount Hope. They have benefited in free dialysis, over 1,000 persons in free dialysis, which they don't have to pay for. Free heart surgery, free medications. This country spends about $1 billion a year in free pharmaceuticals and non-pharmaceuticals. No other country in the world has that level of, I know the word freeness is a bad word, but that's the best way to describe it, where things are just given to patients with no exchange of money. So we could be very, very proud of what we have achieved as a healthcare system, where it is free at the point of delivery. We have moved Sangre Grande from having no CT scanners to now having 2 and 1 MRI. Arima, CT, MRI. It may shock you to know that Northwest, which is the capital city, never had an MRI machine. They have one now in St. James. Port of Spain Hospital has 2 CT scans. So all of these equipment, all of this training, and what we are most proud of, which I discussed at the opening of New Central Block, is the move to technology. One of the biggest complaints you have about patients is when they go to clinics and they can't find their paper file. If I take you into one of the vaults that contain paper files, it will scare you. It's just millions and millions of pages of paper. We have started to digitize all that. Right now, we have digitized 3 main areas where people are receiving superior service. One, what we call a PAC system. A PAC system is simply called Picture Archiving Communication System. That is where all your radiology film goes, like your MRI scans, CT scans, mammograms, x-rays. If you, Sunil, did an x-ray in Port of Spain or MRI, and you fell ill in San Fernando, before this intervention, they will have to re-image you. Now, throughout the country, the doctors and nurses can call up your radiological images and read it. So we don't have to re-image you. You can get care faster. Same thing is applying to your blood work. We have digitized that. So your blood results could be read anywhere in the country. And we are pioneering and implementing electronic prescriptions. So we are moving the system from a paper-heavy system to a paper-light and ultimately to a paper-free system. And I think that is where some of that money has gone, which will redound in faster care, less filling out of forms, and all of this will be less paperwork and more patient work.
A few weeks ago, we would have heard the former Prime Minister, Dr. Keith Rowley, talk about TNT being a sovereign nation in terms of the United States issue as it relates to Cuban doctors. I know Mia Amor Motley, the Prime Minister of Barbados, would have made some statements as well. And I believe, you can correct me if I'm wrong, the Prime Minister of St. Vincent,
yes,
saying, we are a sovereign nation and we can. What's your take on this latest issue as it relates to Cuban doctors?
So I am so proud of former Prime Minister Keith Rowley and the other Caribbean Prime Ministers who have stood up for small states, but sovereign states. That is in stark contrast to some local commentators. I won't call names, because this is not a political platform, but everybody knows who I'm speaking about, who has never once stood up for the sovereignty of Trinidad and Tobago. We may be small, but we are not insignificant. And size does not mean that we don't have feelings. So Dr. Keith Rowley is one of those leaders who stood up for us. On the issue of the Cuban presence in Trinidad and Tobago, we currently employ about 89 Cuban nurses and about 9 Cuban doctors. But contrary to what those opposed to us have been saying to send them home, these are specialist positions. And I want to ask those who are speaking to send them home, when these specialist nurses are not there to provide the dialysis treatment because we don't have enough in Trinidad, and those patients die, Who is going to accept the responsibility for that, Sunil? When those specialists, physicians, and surgeons can't perform the life-saving surgeries, who is going to take the responsibility for that? So when we in the parliament call people unpatriotic, that is what we mean by unpatriotic behavior. And we are going to stand with our CARICOM colleagues on this issue.
You mentioned the word freeness earlier, and we in TNT continue to receive somewhat free healthcare. Some prescription drugs are available through the CDAP program. How would you describe the level of healthcare provided to the nation at this point in time?
Good to very good. No healthcare system can claim to be excellent. It just does not exist. There is no excellent healthcare system. But I would place Trinidad and Tobago in the good to very good category. Because one, as in other, we always hear why Trinidad and Tobago can't be like this country, can't be like that country. In that country, where we are asked to compare to ourselves to, if you don't have medical insurance, you sit down on the pavement and watch that gleaming hospital and you die because you don't have insurance. If you have insurance and you use up your insurance to the limit that you have it, after that, you get no care. In Trinidad and Tobago, that does not happen. We have what is called universal health coverage, which means you get health coverage from being pregnant, to being born, to being a child, to being an adult, to the elderly. Trinidad and Tobago, our healthcare system, regardless of who is in office, has always provided the best level of healthcare that it can afford, as compared to other more developed countries, where if you don't have insurance, you are in a bad position. You will have to pay out of pocket.
Minister, you would acknowledge, though, that we do have some challenges in the health system, like in terms of long waiting times to get certain medical procedures done. So I'm not sure if you can correct me if we do have a shortage of drugs, sorry.
Yeah.
But what's being done to address this?
Yeah. So as I said, no healthcare system is perfect. None. So we acknowledge that some patients have to wait. We acknowledge that. But coming to the issue of drugs, I have always told this country, and you could check it on the internet, there is a global shortage of pharmaceuticals and non-pharmaceuticals, especially post-COVID. But I promise this country that if there's any shortage, it will not be chronic or long-lasting. We don't make drugs in Trinidad and Tobago. We have to import it. And very often, the companies abroad will tell us we are too small. That is one of the issues that we are faced with. But I'll tell you something. We are in a better place than many bigger, more resource countries when it comes to having a pretty stable drug supply. And one of the issues being bandied about these days is, because I hear it on platforms, is that we have no CDAP drugs. Let me say categorically, that has always been something being pushed out there to scare people. There is no chronic shortage of CDAP drugs. What happens is that a particular pharmacy may run out, but there are stocks in C40, they just have to reorder. So I want to make that abundantly clear. And let me say it again. There are global supply chain challenges with pharmaceuticals and non-pharmaceuticals. But we have managed to overcome a lot of that.
You would have recently said that, TNT is moving closer to that UNAIDS target of 95 in 2030 in terms of HIV reduction. What does this mean? And how far along are we in achieving this goal?
So you and I may know what 95 means, but I think our viewers looking at this program may not know, so I need to explain what it means. The United Nations has set a goal for 2030, 95, 95, 95. What does that mean? The first 95 means that any country that has a population living with HIV, so let's say there are 100 people in Trinidad and Tobago living with HIV, 95% of those, or 95 people, should know their status. That is, know I have HIV. So that's the first 95, that 95% of those with HIV should know their status. The second 95 is that 95% of the first 95 should not only know their status, but be on medication, what we call ARTs, antiretroviral therapy. So that's the second 95. So when you are on these drugs to decrease the level of HIV in your system, the third 95 is that 95% of that second 95, that is those taking drugs, should have their HIV, what the doctors call your viral load, so low and so suppressed to a point where you cannot transmit the virus. So I hope I have clarified that for the layperson. First 95, 95% of people with HIV should know I have HIV. Second 95, 95% of that first 95 should be on drugs. And then the third 95, 95% of those who are on drugs, the drug should be working so well in their system that the HIV viral load is so depressed that they can't transmit the disease. So that's where we are, which is a pretty good place to be at this point in time. We are doing better in the CARICOM context. But more importantly, one of the other measures we use is the number of new infections per year. In 2010, we had 824 new infections. By 2024, last year, that decreased by 50% to 424. So not only is our, what we call our 95-95 cascade, because the cascade goes like this, pretty good. What is also pretty good is the 50% drop in the number of new infections from 2010 to 2024. And that is what we are doing on the HIV front.
The University of the West Indies, St. Augustine campus, at the campus council meeting just a few weeks ago, the campus principal, Professor Rosemary Bell Antoine, would have alluded to the fact that its research department is very close to finding a cure for antibiotic resistance. Is the ministry aware of this and any collaboration?
So we have a point person at the Eastern RHA who is the point person for antimicrobial resistance. And they are, I believe, on that team as far as I know. So yes, we are very keen because WHO lists antimicrobial resistance, especially antibiotic resistance, because there's antibiotic resistance, antiviral resistance, antifungal resistance. Antibiotic resistance kills about 1 million people per year globally because the normal run-of-the-mill antibiotics no longer work because we have overused it, misused it, and abused antibiotics for decades. That has given rise to antibiotic resistance. So WHO lists that as one of the 10 major concerns. So we are working assiduously with everyone. But what is appealing globally is the fact that artificial intelligence is making the finding of new antibiotics much easier. And AI has come up recently with one called Halicin. And Halicin seems to be an antibiotic of the future. And because AI discovered it, I don't know how old you are, Sunil. There was an old movie called 2001 Space Odyssey, you know it? In that one, it's an old movie. There was a computer called HAL. And HAL was a version of AI. So they have named this new antibiotic discovered by AI, Hallison, after that computer in that movie, 2001: A Space Odyssey. So we look forward to Hallison being rolled out.
I don't know about that movie, but I know about the Jetsons.
You're showing your age. You don't know what Flintstones do.
I know about Flintstones, yes, yes.
Yeah,
yes.
yeah. So Jetsons is
Yeah.
another example of AI, right? And what technology can do.
Minister, what would you say are some of your major successes over the past 5 years?
I wouldn't personalize the successes to me as an individual. What I will say is that I have been lucky, I have been privileged to lead 22,000 people working in all the RHs and the Ministry of Health. And I will say that they have worked with me. They have worked with me to do right by the citizens of Trinidad and Tobago. In the area of HIV/AIDS, I just gave it to you. Bringing down the incidence of NCDs, we have worked really, really hard. Bringing down the incidence of maternal mortality rates, we have worked really, really hard. So it's not about me. It's about the people I have had the privilege to work with and lead. And all of us together, all 22,000 of us, can say we have done right by the average Trinidadian and Tobagonian.
I'm not sure if you would have seen it, Minister, but there's an allegation of maternal deaths. I saw it on social media. Do you want to refute
Sure.
this?
So there will always be maternal deaths. No country in the world has zero maternal deaths. But what we have done is bring it down significantly, and we have met our SDG goals, Sustainable Development Goals, for maternal deaths, which we should have reached in 2030. We started to hit those in 2018. Unfortunately, there are some maternal deaths which are unavoidable in any part of the world. Embolisms, mothers with extremely high blood pressure, uncontrolled diabetes, obesity, viral infections. These things are uncontrollable. But what we have done is the controllable factors. We have managed to decrease maternal mortality by paying attention to those issues we can't control. But we are still working in our antenatal clinics with our diabetes and pregnancy program to get our mothers healthier.
Minister, is there any particular goal you would have wished to accomplish within that 5 years that you haven't gotten a chance to?
Well, I think all the goals that we set out, maternal mortality, HIV/AIDS, NCDs, we have achieved. And as I said, there is always more to be done. So I think the next Minister of Health will inherit a platform, a policy position, because development is a process. No one minister in any ministry accomplishes everything in 5 years. It's a process. But I think over the past 10 years, under my tenure, we have done a lot, we have accomplished a lot, but there will always be a way to go. One of our other achievements is decentralization of mental health, taking a lot of stigma around mental health and St. Anne's by decentralizing mental health. That's another key priority area we worked on, but there's more work to be done. And there will always be more work to be done.
If you were to rate your performance over the past 5 years out of 10, how would you rate it?
So I will answer it by going back to the same question you asked earlier. It's not about me. It's not about me. It's about the 22,000 people I have the honor to lead. And if I have to rate them, I will say they have done spectacularly well.
Minister, your final thoughts as we are in the election season and we shall see the election date, the election date coming closer and closer to that April 28th date.
I just want to tell Trinidad and Tobago that the People's National Movement, the party to which I belong, has listened to you. I want to recognize and congratulate Dr. Rowley for being a statesman, for being unselfish. And I think that move to resign, to give up power, to give up authority, speaks to the caliber of the man. And now we have change. He has passed the baton on to a 50-year-old person. That is going to be one of the young, and we always say, why don't we bring the youth in? This is Trinidad and Tobago's opportunity to show that we will repose our faith in Prime Minister Stuart Young and his team. His team, if you look, you have some of the more mature people like myself, but you still have some of the younger people who have been there, some of the younger people to come in. And this is change. This is meaningful change. This is not exchange. This is meaningful change that the electorate can put its hand around, embrace, and see something, see a future for young people that we have passed the baton on to a younger generation.
Well, we have been speaking to the Honorable Terrence Deyalsingh, the Minister of Health in Trinidad and Tobago, someone who's, as I said before, led us through the COVID-19 pandemic, who is seeking re-election in Arangua St. Joseph. Minister, thanks so much for joining us.
My pleasure.
I'm sure we will see you on the campaign trail, just as how we saw you on that PNM platform.
Thank
jumping.
you very much, Sunil. I might dance again.
We look forward to it, and you've been called the most memeable character
I know.
in the government. But thanks so much for joining
You're
us.
welcome.
It's been a pleasure, and
You're welcome.
we'll see if you will retain that seat as well.
Thank you very much.
And as well the Minister of Health.
We will see.
Next. Join us at the same time next week for another episode of Delving Deeper. I am Sunil Lalla on behalf of the entire crew. Have a great night.